Good afternoon, everyone, and welcome. I'm Leanne Humphreys, and I'm the Director of Training and Workforce Development here at Phoenix Australia Centre for Post-Traumatic Mental Health. Thanks for joining us. Today, we'll introduce you to the new Disaster Mental Health Hub and move on to discuss strategies for improving mental health outcomes after disaster. Before we do that, I'd like to acknowledge the Gundungurra and Darug people who are the traditional custodians of the land where I am, as well as acknowledging the traditional owners of the lands where each of you are. These lands are places of ceremony, celebration, initiation and renewal, and the local Aboriginal peoples have always had and continue to have a unique role in the life of these lands. So to outline how today's webinar will run, firstly, it'll be my great pleasure to give you a brief virtual tour of the Disaster Mental Health Hub, and then I'll introduce you to our panel of experts, each of whom have really interesting and varying perspectives on strategies that you can use to support mental health recovery after disaster. And to frame our discussion, I'll be asking the panel a series of questions, and there'll also be an opportunity for you to ask questions at that time too. Just before we begin, though, I'd like to cover some housekeeping. And as you can see on your screen, there are two boxes below the webinar stream. One's a chat box where we encourage you to comment and chat with each other by entering your name and clicking Join Chat. And the other is a Q&A and polling feature. And we encourage you to ask questions, but also to vote for questions that you'd like our speakers to respond to. And you can do this by typing your question and either entering your name or leaving it blank if you'd rather remain anonymous. So should you see a question you want to vote for, hit the like button and we'll try and answer it today. There'll also be a poll towards the end of the event, which shouldn't take more than a minute or two to answer. So please complete this by navigating to the polls tab within the Q&A feature, and I'll let you know when that poll has been launched. Should you experience any technical difficulties, please navigate to the chat box at the bottom right of the page and our team will be able to assist you. So let's move on to an overview and a virtual tour of the Disaster Mental Health Hub. And as we know, disasters, particularly natural disasters, are common in Australia. As health practitioners, community workers and volunteers, it's really important to be prepared so that we can better help individuals and communities recover. And it's our very strong wish that the Disaster Mental Health Hub will help you do just that. The Hub's been developed by Phoenix Australia in collaboration with primary health networks and other stakeholder groups, and it's been funded by the Australian Government under the Disaster Response, Improving Mental Health Outcomes and Promoting Recovery from Trauma program. The initiative came about when the Department of Health recognised that during disaster, healthcare workers and others needed ready access to information and a range of resources that would support their work with disaster-impacted individuals and communities. In addition, the availability of more in-depth training available during calmer times would mean that workers could return to the site and prepare themselves for subsequent disaster work. And what we hope we've achieved is a website that provides you, as busy practitioners, with quick access to free disaster mental health information, practical resources like tip sheets and videos, as well as online training programs. So I'm going to share my screen now. Fantastic. So with regards to how information on the Hub is presented, you'll find that the resources are arranged according to the three phases of disaster response. So we have prepare and respond and recover. So if we click through to the prepare phase, we can see a brief introduction to what best practice in mental health disaster preparation might look like. And the information's introduced in both written as well as video form. The information, you might decide that you only have 10 minutes available at that time, or you might like to scroll down and access more detailed information if time permits. Scrolling down even further, you can then access some really specific materials and resources such as tip sheets and audio files, as well as guidelines. So there's a whole range of content there. Moving back to the home page, I'd like to draw your attention to a really key feature of the Hub site, and that is the disaster recovery toolkits. The toolkits address a range of common mental health consequences of disaster and helpful strategies to address them. So, for example, we might take a look at several of the toolkits. The first one we'll look at is the sleep toolkit. Now, there's a similar structure to each of the toolkits. They start with brief written introductions as well as a 5 to 10 minute video, which is a conversation with an expert in which really just key elements are highlighted. And here we're thinking of those disaster times when you are really busy, you don't have an awful lot of time. You might just have 5 to 10 minutes, but you need to take away something really practical and useful. And then when you have more time, you can take a deeper dive into the step-by-step how-tos of addressing those problems. Those step-by-step guides, or each of the step-by-step guides, are also supplemented by a series of downloadable resources that you can use in your practice. So we've got assessment tools, handouts for your clients, and in some cases, so in this case, complete downloadable treatment manuals. So, for example, in the case of sleep, we know following disaster nightmares are common. So here is a downloadable imagery rehearsal manual. So if we go back now to the home page and review one more toolkit, I'll take you down to the physical activity toolkit. And this toolkit was developed under the guidance of one of our panel members, Associate Professor Simon Rosenbaum, who you will meet shortly. It's a really interesting toolkit examining the role of physical activity in improving mental health outcomes after trauma and disaster. And again, we've got a similar structure. We're starting with a brief introduction and an informal conversation with our experts. So again, if you only have 10 minutes, these materials will give you something really practical and useful in a short space of time. And then when you've got additional time, you can come back and drill down to more detailed information. Again, we have step-by-step guides. And in this case, we have a series of references for further reading as well as a podcast here. So moving on to our preparation page, I'd like to draw your attention to another really key feature in the Hub site, and that is our recovery capitals resources. Now, up until now, with the disaster recovery toolkits, we were focusing on strategies that can be used to support individuals experiencing psychosocial difficulties after disaster. But these recap resources focus on evidence-based guidelines regarding factors that positively influence the recovery process for individuals and communities. And here there's a really strong focus on taking a strengths-based, holistic and inclusive approach to recovery. So if we click through here, we'll find information about the project, a brief introductory video, and again, step-by-step guides or a step-by-step approach to better understanding the various recovery capitals or resources that can be used to support individual and community wellbeing after disaster. So from here, I'll very briefly mention our online training. We currently have 2 online training courses. So here we have working with the effects of disaster and trauma and working with post-traumatic attributions. By the end of March, we'll have 2 more, trauma-informed self-care and psychological principles of disaster care, and each of the programs will be 60 to 90 minutes duration. So folks, that's a very brief introduction to the Disaster Hub. Obviously, we really hope that you take the time to engage with the materials in the Hub, to download the things you need, to bookmark the courses you're interested in and come back to them when you have time. But just to finish up, I'd like to mention that we also have a survey that you can access via this link here. We'd really love your feedback and suggestions regarding additional resources that we could develop for the Hub that would support you in your work in your work. Okay. So now I think it's time to move on to our panel discussion, and I'd like to provide a quick introduction to our experts. Andrew Coughlin is the Head of Emergency Services with Australian Red Cross. He has over 20 years' experience in the emergency management sector, and in his current role he oversees the National Emergency Services function and ensures Australian Red Cross's ability to promote resilience and build community capacity, both in preparation for and response to disasters throughout Australia. So a very warm welcome to you, Andrew.
Thanks, Leanne. Lovely to be here.
Thank you. Professor Lisa Gibbs is the Director of Child and Community Wellbeing in the Melbourne School of Population and Global Health at the University of Melbourne. She leads 2 areas of public health research, disaster resilience and child health and wellbeing, and she's committed to ensuring the relevance of her research through translation into direct policy and practice outcomes. And welcome, Lisa. Very glad you could join us. Scientia Associate Professor Simon Rosenbaum is an exercise physiologist and works in the School of Psychiatry at the University of New South Wales. His research focuses on physical activity, mental illness, sport for development and global mental health. He's worked with a variety of groups including emergency services workers, youth, veterans and refugees. So welcome, Simon. Thanks so much for joining us.
Thanks for having me.
And my colleague Jane Nursey. Jane is the Director of Clinical Services at Phoenix Australia. She's a clinical neuropsychologist with almost 30 years' experience in the field of post-traumatic mental health, including working with Defence Force, police and other emergency service personnel and disaster survivors. She's also been involved in longitudinal research looking at the long-term outcomes of the Black Saturday bushfires. So welcome, Jane.
Thanks, Lisa. Thanks, Leanne. Lovely to be here.
And my colleague, Alexandra Howard. Alex is the Director of Disasters and Public Health Emergencies at Phoenix Australia. She's a clinical psychologist with more than 10 years' experience in post-traumatic mental health. She's worked with disaster-impacted communities and the health professionals who support them. And she's leading Phoenix Australia's work with the Department of Health to build capability for emergency service and GP practice staff in bushfire impacted areas. So welcome, Alex.
Thanks, good to be here.
So on to our panel discussion, and just a quick reminder before we start, please feel free to ask any questions in the QA area or consider voting on the questions you'd like to have answered. And panel, I might ask you to respond to each question in turn if that's okay. So panel, my first question, from your individual perspectives, what have you found to be the major barriers to mental health recovery following disaster? And Andrew, I might start with you.
Yeah, thanks, Leanne. And if I could just start by acknowledging the great work Phoenix have undertaken in putting together the materials that you were taking us through earlier. It's a really fantastic tool. I think reflects the input of a lot of different organisations and the expertise of a lot of people who have worked really well in partnership. So thank you for that, firstly. In answer to the question, I'd probably like to focus more on a couple of characteristics, I think, of a good recovery program. And one is the effectiveness of the recovery system itself. So the agencies and organisations and communities working well together. I think that underpins good mental health outcomes for people across the board. And secondly, and obviously very importantly, the individual support and accessibility to that support that's available. In terms of the broader systemic things, I think the community awareness of the long-term nature and impact and complexity of disasters, while the knowledge of it is increasing and improving, there's still a long way to go. I think for a lot of people, they see the media coverage of disasters and think that, within 6 months, everyone should be in a new house back to where they were and no problem with your life sort of thing. Organisations like Red Cross and many others who I'm sure are on the call today live and work in these communities for years and years after the event and see the aftermath of these sorts of things and the impact on people's mental health and well-being more broadly. So any education we can do around that, both during and between disasters, I think is critical. And then secondly, at the individual level, I think there's still issues these days around access to mental health services. An event like the fires of last year, Black Summer, as they've become known, there's a range of organisations and funding opportunities and things that come to the fore, but particularly in some of the smaller scale disasters that happen in between those large events, access, long waiting periods, lack of specialised workforce, particularly in smaller rural populations, can be a challenge. And likewise, I think the more we can do in terms of providing accessibility for different multicultural groups, and indeed safe and culturally appropriate services for a range of vulnerable groups, the better.
Thank you, Andrew. Thank you. Lisa, your thoughts?
Thanks, Leanne. And look, we've had the benefit of working with many partners, including Phoenix and Red Cross, to develop the recap guide that's on the hub. And that draws on the evidence which shows so clearly that all of the things that happen after the disaster can really undermine long-term mental health and well-being. And it's really typical of a post-disaster environment that people may have lost their accommodation, their home. They may have lost their income, their job no longer exists or has been compromised. There's often relationship breakdowns because of all the stress of what families are dealing with. And so people's capacity to recover from the disaster event is actually undermined by all of the things that happen afterwards. And so we really have to pay attention to supporting them in dealing with those life stresses to enable them to get back on track.
Absolutely. So it's almost like we have to think of disaster as two phases. It's the actual disaster, but it's everything else as well afterwards. Yeah. Okay.
That's right. And look, for some people who make a decision to move elsewhere, they may step away from all of those disruptions and the challenges of rebuilding and the damage that's been caused, but they lose that opportunity for a shared processing of the original disaster event. So different issues for different people according to where they are, and that sort of differentiation of service support is also really important.
Thanks, Lisa. Simon, your thoughts?
Yeah, and firstly, thanks, Leanne, for the invitation to be involved, and also thanks to Phoenix for including physical activity in the toolkit. It was really great to see, because it is often an underutilised and underrepresented aspect of mental health treatment and recovery. And I think coming back to your first question about the barriers, for me, it would be around physical health. And, we see this emergence of what's coined lifestyle psychiatry, and it's these modifiable risk factors. It's someone's activity, it's someone's sleep, it's someone's diet. And also alcohol and substance use. And we know that all those factors play a big role in physical health, but similarly, they're really important for mental health. And if we talk about trauma-exposed communities, we know that that's associated with a decline in activity, and it's associated with a change in lifestyle, and that can feed into physical health and also feed into mental health. So that would be the area that we'd be focusing on.
Absolutely. Thank you. Jane, your thoughts?
So look, I think one of the things perhaps hasn't been mentioned is the propensity of people to really get caught up in the issues that they're needing to deal with and or self-isolate. So, people tend to withdraw after a trauma. They withdraw to protect themselves, to stop themselves being reminded of what happened, to avoid additional stresses. And the more they isolate, the less availability they have really to knowing what's out there and how to seek help. And so I think, as Andrew sort of mentioned at the beginning, that education piece around knowing what to expect, what are the short and long-term outcomes, and how might you go about seeking support for those. I think the other thing is people often diminish the importance of their mental health in terms of the priorities around rebuilding and the recovery that Lisa went into. And people can get caught up in their anger around what's happened to them. They can get caught up in the grief associated with what's happened to them. And the idea of going and seeking help for those issues is actually not something that occurs to them.
Absolutely. Thanks, Jane. Alex, your thoughts?
Yeah, just a couple of things to add to all of the insights already. I think we couldn't have a webinar in 2020 or 2021 without mentioning COVID-19 and the restrictions associated with that, and the complications that has led to in terms of people. We know that community and social support is really key in people's recovery, and having that really disrupted by COVID-19. And I think for even in 2021, there's this new realization of, gosh, we really are in this for the long haul in terms of COVID normal and what that might look like. So I think that's one of the things. There are some opportunities that have come with that in terms of pushing us onto telehealth more quickly, and the opportunities that provides us in terms of being able to overcome some of the barriers around workforce issues in regional areas. But I think that's something to consider. And the other thing is the barriers that exist for people, or the vulnerabilities or groups that have already been marginalised before a disaster. We know that a disaster is just going to exacerbate those difficulties and differences. So just being really aware that, people aren't coming to a disaster with a blank slate, or kind of with everything in order, and just kind of the different paths and complications that roll out from that afterwards.
Absolutely. Thank you, everybody. My second question, from your different perspectives, what strategies do you think are the most effective in supporting individual and community recovery following disaster? And again, I might go back to you, Andrew.
Yeah, thanks, Leanne. And again, I'd go back to that notion of the long-term nature of recovery and the importance of people understanding that. I think context is really important. People don't live in a vacuum, and disasters don't happen in a vacuum. They happen in communities where people live. So there's a set of recovery principles that underpin a lot of the work that most organisations do, which talk about recovery being community-led. And I think the more we see that, the more effective the supports we provide. The other thing I would highlight too is the concept of flexible and different ways, agile ways of delivering services. I think, ranging from the sort of work that Simon was talking about earlier, right through to the building of social capital. There are a range of different ways that people will find support and will find comfort and the ability to get on with things in what is a very long-term process.
Absolutely. Thank you. And Lisa?
Yes, I'd like to add to what Andrew was saying, because the social connections come through really strongly in our Beyond Bushfires research. When we worked with families and individuals and communities for 10 years after the Black Saturday bushfires, we found that if people belonged to a local community group, they were more likely to have better mental health and wellbeing outcomes.
Yeah.
And interestingly, if there was a community where many people belonged to a community group, like to different community groups, those benefits extended to others in the community. So there was a spillover benefit, which we can only assume was a sort of high level of trust and reciprocity in those communities, or something similar. So that came through as a really important protective factor. The other thing that came through was connection to the natural environment. And even though people who felt an attachment to the natural environment really grieved when it was damaged by the bushfires, they still drew from the recovery of the bush and their opportunity to spend time outdoors as part of their recovery. And that was reflected in every mental health and wellbeing measure we looked at.
That's fascinating. Thank you. Simon, your thoughts?
Yeah, look, I would just echo what Andrew and Lisa have said. I think the social support and the social connection is hugely important, and we know that sport and physical activity and sporting organisations can be a vehicle to actually facilitate that. The other thing that they can offer is they can be a pathway into more traditional mental health care. It's destigmatizing, it's acceptable. People are happy to turn up to the local soccer club for a football club or cricket club for a sausage sizzle, and that can be a way to facilitate some of these discussions. I think one of the other aspects is around prevention. We've got really good data showing that keeping people active or even increasing activity levels can actually prevent depression, can prevent anxiety and is associated with trauma exposure. So I think there's a lot of avenues there as to why we could be better utilising these services that the community actually identifies and already have access to.
Absolutely. So like a level 2 intervention in and of its own right. Yeah.
Absolutely. Yeah.
Yeah. Yeah. Fantastic. Thank you. Jane, your thoughts?
Look, I'm going to keep the broken record going and re-emphasize that whole idea of social connectedness, because we know just how powerful it is in terms of facilitating recovery, and what a barrier to recovery it can be if you aren't connected. You know, that social isolation is a real red flag for developing mental health disorders following disaster.
Yeah.
But I think the other thing that social connectedness does is help to promote empowerment. You know, by getting engaged in the community, there's a sense of self-efficacy that goes along with that. And we know that building self-efficacy is also another really important principle of recovery, along with building a sense of hope. And again, it's really hard to have that sense of hope when you're on your own struggling with your own issues. But being part of a community that's working towards the same goals really helps to establish that sense of hope and empowerment for the person.
Thanks, Jane. Alex?
And I think touching on some of Jane's points in particular about those principles underlying recovery and those principles of hope and self-efficacy and social connectedness are what underlie psychological first aid, which is, I'm sure, an approach many people are familiar with. And you referenced earlier, Leanne, I think you said, oh, that's a level 2 intervention for Simon. So kind of having a stepped care approach for care. So thinking about what are the principles that do no harm, that, you know, would the people down at the local sports community centre would benefit from having an understanding of these principles, all the way to kind of filtering up to those more specialised mental health interventions. So one of the things that we've also been funded by the Department of Health to do is to kind of do some local capacity and capability building within these impacted regions and give them particularly psychological first aid skills, and also some information about trauma-informed care as well.
Fantastic. Thank you. I guess that following on from that question, I think it's important to recognise that not everything we're doing really lends itself to high-quality clinical trials, and so that when you all consider the strategies that you employ in your work with disaster-impacted individuals and communities, how do you know that what you're doing is effective? How do you gather evidence? Again, and I might go back to Andrew.
It's a good question, and one that I think as a sector as well as individual organisations we're grappling with and improving on over time. So from a Red Cross perspective, relatively recently we've gotten in the business of, you know, setting up things like monitoring and evaluation frameworks for the work that we do in disaster affected communities, and coming up with indicators that are drawn from research that you can evaluate your work against. And we've done quite a bit of work with Lisa and her team in developing some of those, and they've indeed gone on and become a really critical partner in terms of doing some of those monitoring and evaluation exercises for us. At a more sort of grassroots type level, and something we've probably done more traditionally, we do things like put phone calls into people that we've had a connection with during a disaster to see how they're tracking, just a very informal thing. Or we go on door-to-door outreach visits as part of our recovery programs. In the first instance, we generally have volunteers in evacuation centres and places like that when disasters unfold. That gives us as an organisation a really powerful connection with people as they go through what might be a traumatic experience for them. And we're able to, I guess in a sense, shamelessly use that connection to go back and see where people are at different stages along the recovery journey. And what we've been trying to do most recently is really, out of the Black Summer experience in particular, get our teams on the ground to actually gather some of that data and do a bit more analysis around it and share that information with different organisations. So rather than us just thinking that we're doing really good work with an individual or a couple of people in a community, we're actually trying to turn that into some data that can actually drive what a broad range of organisations are doing. And just to share with you, we do a monthly situation analysis where we draw on the 20 or 30 recovery workers we've got out in the community. And the one that we did at the end of last year, just as an example, highlighted some really useful things. Like, we found that the greatest majority of people we spoke to were actually anxious and nervous about the upcoming fire season or cyclone season, depending on where they live. People were starting to feel tired and fatigued. There was still, nearly 12 months on, gaps in terms of service provision. And quite significantly, I think, there were reports of quite a bit of community division starting to open up. And these are the sorts of things that give us some really good indicators of what we ought to be focusing on in our longer term recovery work.
Fascinating. Thanks, Andrew. Lisa, from your perspective.
Oh, Leanne, I could talk about this all day. It's such a challenge to evaluate strategies well, because, you know, I'm a public health academic, and so what you would normally be looking at is multiple levels, multiple types of strategies across different sites and settings. And so really what you're looking at is lots of small things that are aiming to have a collective impact, and capturing that in an evaluation that doesn't suck all the funding out of the recovery interventions is really tricky. So we do use different types of research methods to capture different learnings. A good strategy, particularly in a post-disaster environment where it's messy and you know it's difficult to capture baseline data, is we try and see what existing data sets are there that can increase our learning. So, for example, one of the things that we've done in terms of the impact of disasters on children is to have a look at academic results for kids in schools across Victoria and categorise based on disaster impact, and follow them across the schooling years to learn about, well, what are the learning impacts, and what does that tell us about what sort of mental health supports might be required. And so Jane and I were involved in that together. So it's very challenging, and we keep working at it, and it's about using different methods for different purposes in different contexts.
And being mindful of not overburdening the people that we're trying to support.
Well, exactly. If we can use existing data, we don't have to intrude on people's recovery experience. But if we are going to engage in research with communities, we've found the best approach is to do that in partnership with them. And so we decide together how we might proceed, and share decision making.
Terrific. Thanks, Lisa. Simon, your thoughts?
Yeah, I was going to share something similar to Lisa. You know, I think the issue around research in these environments can be really tricky, and also why we're doing that research and who the end users of that research are, and how we actually keep them in mind from the very beginning, and the beginning and the reasons why are actually very clear why we're doing this. From my point of view, I think, you know, my interest is not so much in efficacy research, you know, or randomized control trials, but actually taking interventions that we already have a big evidence base for, and asking the question, how do we apply this in certain contexts? So, you know, we call that implementation research, saying how do we make something that we know works in the ideal environment, but take it to a specific context with specific cultures, with specific people, with specific challenges, work with the local community, let them guide the process and support them to adapt that intervention for that context. So again, similar to what Lisa said, that co-design aspect I think is absolutely critical, and you know, the simplest thing we can do is ask people and let them be the driver.
Yeah, terrific. Thank you. Jane, your thoughts?
Yeah, so look, I think RCTs have their place and are really important in determining efficacy of new interventions and treatments for mental health disorders, for instance. But I do think it's also really important that as a mental health practitioner, I have the ability to evaluate my own work and impact with my clients. And so I think that there's a range of things that community workers and health workers can do to just evaluate what sort of impact they're having. And I think that can, you know, cover off on things that I've already spoken about. So sending out really brief valuation questionnaires, 2 or 3 questions at the end of a period of you've been seeing or treating someone or seeing someone, and asking them about how they found the service. Were their goals or needs met? Do they feel confident that they can go forward to manage the problems that they came to you with? You can also, I think, use some brief outcome measures. So looking at a simple scale of distress like the K10 or the DAS, and use that throughout your treatment journey with the client, at the beginning and certainly at the end, but perhaps from session to session, just to notice how their symptom profile might go across that period of time. I think keeping records on the number of people you're seeing and how often you're seeing them, and whether or not there's changes in the frequency of their attendance or their need to be seeing you, that might talk about how much of an impact you're having. And I think also just even basically looking at, are they sending friends and colleagues along? More and more people from that community seeking support for you. Might give you some indication. So I think there are lots of small things that practitioners can be doing in order to build a bit of evidence around the effectiveness of their work.
Absolutely. Thanks, Jane. Alex, your thoughts?
I thought this was a great question when I first read it, and did cause me to take pause for a moment to think about, how would I go about this? And it is a very challenging area, as people have already mentioned. And I think it's really just summing up what other people have mentioned. And it is that you're forced to be kind of creative in the way that you evaluate. You may not have all the tools and the timelines working in your favor, but it is just thinking about how can you use what you've got without overburdening other people. And I think Jane made a really good point that it can be at an individual level. And then Andrew was saying from an organizational level, they do their monthly kinds of checks and evaluation, all the way up kind of the work that Simon and Lisa do in terms of these big intervention pieces and things like that as well. So yeah, I think just being a bit creative, which is part of what makes this field really interesting to working, but is definitely one of the challenges.
Fantastic. Thank you. Thank you all. My last question to the panel. Where to from here? What are the most important questions we still have to answer regarding mental health recovery after disaster? And again, I'll go back to you, Andrew.
Thanks, Leanne. I'm not sure if this is a mental health specifically challenge, but to me, possibly the greatest single challenge we see in recovery is people's simple access to support services, what they need, when they need it, and where they need it. I would share with people that I had a vivid experience about this time last year down in Gippsland, down not far from Malakuta, meeting with one of our volunteer teams with a woman whose family had been through the fires, and she, in graphic detail, expressed to us the challenge she was facing going through a list of about 20 different offers of assistance from different organisations, ranging from a $200 voucher from Bunnings that you could access if you'd lost your house, right through to support through a Red Cross, a government agency, a mental health provider. And she was talking about the challenge for her now was to navigate her way through this system of supports. If we do nothing else in the next few years, I think if we could get that right, so there's an easy entry for people and a sense of being in a well cared for wraparound style service at the point at which you need it, mindful you need to come and go from it when it suits you. I think that'd be a really good outcome for people's well-being generally, perhaps not specifically mental health-wise. And the other thing I would throw in the mix is how do we continuously improve the support we provide for our recovery workers? And by recovery workers, I don't just mean people who work for a Red Cross, for a Salvation Army, for a state government. I also mean the informal recovery workers, the community leaders who we see give up literally years of their lives to sit on recovery committees, to lead different groups who are doing rebuilding or revegetation or whatever else it is. I think there's quite a bit of work still to be done in how we better support those people so they have good longer term outcomes and haven't put their lives on hold for a number of years and then get to a point where they hit a wall in a couple of years' time.
Yeah. Yeah. Okay. Thank you. And Lisa?
Yeah, look, I think there's still so much for us to learn. We spoke about briefly, and I've noticed it in the questions, the importance of community-led recovery, and that sense of autonomy is a really important aspect in terms of mental health. But it's really complex. It's quite difficult. It's not like the community is a single entity, and the people who are engaging in that process are the ones who have been affected by the event. So we're trying to learn how best to support a community-led recovery process. So that's one area that we're focusing on to support mental health after disasters. Another is the reality that we're all living with now, which is multiple exposures, overlapping disasters. And what does that mean? And how do we address that? And I guess tied to that is that with the recognition of climate change and eco anxiety in relation to that, how does that affect people's sense of hope? And Jane and Alex were talking about how important hope is to recovery. Well, what does that look like if people feel like this is just going to keep happening? So we need to understand how we address that sense of anxiety about our future. And just a final one to add in the mix, Leanne, is we still know very little about Aboriginal people's experience of these disasters. There's been some really powerful pieces that have been written in the past year about the added pain and distress because of damage to, you know, cultural sites and the connection to local landscapes and intergenerational trauma. But also so much we can learn from expertise around healing of country and healing of community. And so I think that we really need to support extra work in that space as well.
Thanks, Lisa. Good observations. Simon, your thoughts?
Yeah, these are all great points. I mean, for me, it's looking at the decline in physical health that we know occurs with trauma exposure and you know, also with PTSD, and really asking the question, if we intervene there and prevent that happening, if we prevent that decline in physical health. So we're talking about things like obesity and diabetes that go hand in hand with trauma. If we prevent that decline in physical health, does it alter the trajectory of the mental health symptoms? And there's some good evidence suggesting it might. And at the same token, does it help promote positive mental health and well-being within communities and promote general psychosocial well-being? And I think one of the aspects there that we're interested in is this idea that the resources match the need of the individual. So, for example, if someone's really experiencing high levels of symptoms and high levels of distress, they're going to need more support to actually engage in those sort of lifestyle factors that we know can be protective. So it's moving beyond that idea of just, you know, general information for the community and actually matching the intensive support to the people that need it the most, and also targeting the most vulnerable, who we know are more likely to have worse outcomes.
Absolutely. And I love one of the points that we made in the discussion in the Disaster Recovery Toolkit around the idea that what a mental health practitioner is traditionally might end up changing as this physical activity research evolves. That's very exciting.
The evidence base is there, so it's just acting on that. And what Alex said before about, you know, training local sporting clubs in PFA and psychological first aid. Similarly, we need mental health professionals trained in basic exercise, prescription, physical activity, promotion, and they're things that can happen immediately. You know, we know what to do and how to do it. It's just bringing those worlds together.
Absolutely. Yep. Thank you. Jane, your thoughts?
So look, I guess they echo everything that's been said, really, but I do think one of the biggest challenges is being able to build capacities in the community to provide a stepped care approach to support following recovery. And that means educating and skill building at a community level, but it also means educating and skill building at a health professional level. And I think that there are real gaps at the moment in terms of the number of skilled professionals we have to provide you know, secondary and tertiary interventions for people who do go on to develop mental health disorders. And we certainly lack the numbers out there, particularly in remote and regional communities, for people to be able to access support easily. I think going along with that is that we still have a lot more to learn about how to actually effectively treat mental health disorders arising from trauma.
Yeah.
And I think we also still have quite a bit to learn around prevention. Even though we've come a long way, I still think that those are two big challenges that we continue to have.
Absolutely. Yep. Absolutely. Thanks. Yeah. Sorry, Jane. Didn't mean to interrupt.
My final one was just really, I think, the importance of really understanding the long-term impacts in children. So when they're impacted by disaster early on, what's the impact of that in their life down the track? Because that's where the money is going to be needed. That's where the support is going to be needed longer term.
Absolutely. Thanks, Jane.
Sorry.
Alex, your thoughts?
I mean, so many fascinating things have being raised. I feel like I need to have a few follow-up conversations with people. And I think it's exposed my bias that I put the burden on sports people to learn PFA rather than mental health professionals to learn some basic exercise interventions. So apologies for that. What I was going to say, and I think it's been touched on by other people, is I think it is about that kind of matching of the right support to, the right individual or community at the right time, and kind of figuring out, if we've got these workplace or workforce issues in particular areas, how to kind of overcome some of those. I mean, I think, there's a lot to keep us busy, certainly.
Absolutely. Thank you so much, panel. I'm going to take some time now to go through some questions that have been coming through on the chat site, and I'm not going to approach them in any particular order, but the most recent one's a question from Trevo. Our society often wants to suppress anger and isolation as negative emotions. What are the positives that can be achieved through anger and isolation? Anybody have a response there, or a willingness to jump in on that one?
Leanne, I can jump in briefly. One of our PhD candidates, Connie Kellett, did some research relating to anger, and it was really interesting because we're used to being concerned about anger or trying to block anger, but actually what she found was that for some people it was productive. It was the only thing that gave them the energy to get up and start trying to address some of the frustrations they were dealing with. And
it's such a motivator, isn't it?
Exactly. And so recognising that it has a role, it's completely legitimate and understandable given what people are dealing with. The concern is when it continues for a longer period, when it's harmful for others, or when it's harmful for the individual. We did find that anger was an indicator of people who had poor mental health issues. So we have to watch out for that. And isolation, some people do need to just spend time on their own to process what they've dealt with. And that's where I thought the connection to the natural environment was really helpful, because actually a lot of people in rural communities in particular go there because they seek isolation, but they're also connecting with the bush and what's around them. And so I think opportunities to engage with that, and recognising that some of the local bushwalks or sites are priorities for restoration to support that.
Yeah, that's a lovely nuanced way of thinking about it, Lisa. Thank you. Another question: how long should organisations remain involved in community activities before stepping back for the community to take over and run by themselves?
Leanne, I might make a start on that one. Others will have views, I'm sure. But I think that's a really complex question. In some ways, I think the answer lies in not stepping back, but in the way that you step in. So I think the most effective recovery programs work really well when individuals, organisations, whoever else come in and support a community to do what they need to do or have to do. And then you can fairly seamlessly leave that community, as opposed to, flying in over the top with all the expertise and all the answers, supposedly, and then leaving potentially a massive hole when you do leave, or the flip side of that, being run out of town because people don't want that approach anyway. So I think sometimes it's about how you get there in the first place and how you work with communities in the first place. Having said
Nice.
that, as an example, after Black Saturday, we had people working in some of the more affected communities for a period of about 5 years. And in Black Summer, we've committed to initially a 3-year recovery program, which, depending where things are at in year 3, it'll taper off, but we may look at extending beyond 3 years as well. We've just found that typically that's the sort of period of time that it's useful to be in there providing some sort of support and assistance. But again, from the ground up, not the other way.
Yeah. Okay. Thank you, Andrew. I might just go with one final question, because I'm just keeping an eye on the time as we're proceeding. Question here: recovery being community-led, what leadership qualities are needed to facilitate this? And I'm assuming from that question that means leadership qualities within the community leaders themselves. Have we any thoughts about that?
We're all reluctant to answer that
I don't
one, I think.
I don't know that there's a job description that you can spell out there. I think, you know, the qualities that you're motivated to help, and that you know, have a willingness to engage with your community members and help lead the problem solving around that. And to do what needs to be done. You have some good organisational skills. You have some good communication skills. I think they're fundamental to leading recovery. But other than that, I think it's, you know, the personal qualities that you have that make you want to be in there helping out, and that you're there for the right reasons.
Yeah.
And I wouldn't mind just adding, you know, I spoke about the importance of connecting to local community groups. We did find that there's a tipping point where if people belong to many groups, it starts to become a burden. And in my mind, I'm thinking, we all know the person who, you know, organises the speakers for the Rotary Club. They're they're the secretary for the local netball club. You know, they're on every committee, and so they're keeping it going for everyone else. But it starts to become a burden for them. And so, you know, that's likely to be the profile of the person on these committees. And so what we need to do is think not just about what type of person they need to be, but more probably about what support do they need to enable them to do their role.
Yeah, yeah.
I think an important part of that is the personal boundaries, I guess. You want to be able to engage with people, but you also need to be able to keep some boundary between yourself and others as well, to protect yourself from everybody else's concerns.
And lots of stories abound of people who've been in those sorts of roles, and at the end of the process, a couple of years in, they look around and where's their family? And, you know, they've let so many other things go because they've been putting out to the community the whole time. So there's some words of caution in all of that.
Yeah, yeah. Thank you, everybody. Panel, I'm keeping an eye on the time. I just want to thank you very much for your comments and your expertise. So thank you, panel. I think we might move towards wrapping up now. So thank you so much for your time. Okay, so that's all we have time for in today's webinar. We do have one final slide for you that shows the link to the hub, other free online training programs for eligible frontline workers, and the Beyond Bushfires study and other related research if you're interested in. We'll now launch a poll, which you can access in the Q&A section below in the video stream. We'd really appreciate you completing this brief poll to help us improve our services and future webinars. And while you're completing the poll, I'd like to thank you all for taking the time out of your day to attend and to learn about how we can improve mental health outcomes after disaster. I do hope you found it informative and helpful, and we certainly encourage you to take some time to explore the Disaster Mental Health Hub. Thank you again to Lisa, Andrew, Simon, Jane and Alex for sharing your expertise with us. And over the next few days, we'll email you a link to a recording of the webinar. So thanks again for your time today, and we hope that you'll stay in contact and join us for future events. Thank you, everybody.